And that's what this conference is about, is community.
Hello and welcome to Digital Health in Canada, the Digital Health Canada podcast. I'm Katie Brisky.
And I'm Sheila Maloney.
We've got 50 reasons for you to listen to this podcast as we celebrate Digital Health Canada's 50th anniversary. Reason number 9, we just came back from eHealth and we have stories, reflections, and insights to share.
So this is a special edition of our 50th anniversary special edition, a special edition of the special edition.
Yeah, so a slightly different format than our usual episodes. Earlier in June 2025 was the 25th eHealth Conference and Tradeshow. We're actually taking you behind the scenes of the conference, so you'll be hearing insights and interviews from the conference floor and hopefully getting a feel for the energy in the conference. And for me, with any conference, I love the buzz in the air as people start arriving. So that's where we're going to start today, with conversations I got around the registration desk on the very first day of eHealth. And we're here with our very first on-the-spot interview, and if I could just get your name and the organization you're with.
Yes, hi Katie, my name is Anjan Sidhu. I'm the Vice President of Healthcare for GS1 Canada.
And Anjan, what are you excited for this, the 25th eHealth conference?
Well, first of all, to meet a lot of new people that I haven't met before. This is my first conference, so I'm really looking to collaborating, understanding what we're doing as Canadians to support efficiency in our healthcare ecosystem.
My name's Lauren McGill, and I'm a content strategist and marketer.
And is this your very first eHealth?
Yes, it is.
What are you most looking forward to?
I'm really excited to see what's happening with artificial intelligence and also what's happening in data interoperability and standardization across the country.
So my name is Amit Syed, and I'm with Gungimoso Health.
And what are you most excited for this eHealth?
So anything integrated with AI, specifically I support the surgical stream. So there's a talk that's coming up tomorrow on integrating AI in anesthesia. And there's a study on it, so I'm looking forward to that. And also, I had helped launch RuCare in Saskatchewan. So there's a lot of talks on mental health aspect of that as well. So those are the two topics that I am looking forward to.
So Sheila, clearly people were very excited to be at eHealth, and I'm curious to hear from you going into the 25th anniversary of eHealth and the 50th anniversary of Digital Health Canada, what you were excited for and whether this conference maybe felt different than past eHealths.
Two things that were different for me. So I've been going to the Digital Health, I think I've been going to the eHealth conference. I've been every single year for the last 25 years. So I've been to all of them and coach conferences before that.
Do you get a prize for that?
Yeah. Actually, somebody told me that there are 7. Somebody in the office figured out that there were 7 people who've been to all 25 eHealth conferences. We should figure out who they are and get maybe a red convertible Mercedes as a prize or something. But I digress. So the thing that was different for me about this conference was, of course, this was my first conference as a CEO of Digital Health Canada. So I was there in a different role, a different capacity. So that was kind of exciting. And many people knew that was my new role, but not everybody. So that was fun to sort of see the conference from that perspective and that special behind the scenes a little bit, from seeing how much work and effort the team puts into it going in. And every single person from Digital Health Canada was all hands on deck for those 4 days. And it was amazing to watch that team work together. The second major big thing is because it was the 50th anniversary of Digital Health Canada, we invited all the past presidents of the board, and we got probably about a dozen. And we had people there who I hadn't literally seen for 20 years. So it was so great to see people show up. And so that had that extra air of celebration and excitement to it, I think. So those are the two big highlights for me in that opening reception. And of course, the buzz of the first day and nobody's seen each other for a year. And I think that we're still in that post-COVID extra excitement for being in person because we don't do as much of it as we used to. It was such a great night and great reception. How about you?
For me, yeah, it was exciting to hear that theme of celebrate today and create tomorrow was very apparent. People seemed hungry more so than in past years, sort of that, I almost want to call it an impatience to get in and have those conversations and figure out how to move the digital health agenda forward. And everyone I talked to was just so thrilled to be there. I think that was the other big insight for me, just in those early hours of the conference, even before the opening reception, as people are getting their badges and people are reconnecting with their colleagues. Every face had this huge grin on it. And for me, like personally, I was very excited, obviously, for getting those interviews and doing the podcast. It was also really lovely to kind of be adopted by the Digital Health Canada team and get to see them do exactly that work that you referenced. It was a really good intro to a really good conference. And then, as you mentioned a moment ago, the conference really kicked off with the president's reception. So I was able to get some interviews with past presidents Don Newsham and Cassie Fraser, and also Elaine Husing, who, while not a past president of Digital Health Canada herself, is the daughter of founding coach president Stephen Husing. So let's turn it over to them and see what they had to say.
A memory that I have as president was working with Dave Watling as the head of CHEETA, the Professional Association of Vendors at that time. And we were at a conference like this, and towards the end of it, we were talking, you know what, there should be an awards ceremony. We should have awards for vendors. We should have awards for professionals. You know, we should do this. And like, well, Dave, we should do this. Well, Don, let's do this. Okay, let's go. And that was the start of the awards that we still do today, in one form or another. I think it was about 2008 that we started that.
I love that. Like, wouldn't it be great if, or wouldn't it be cool if idea becomes an institution?
Yeah.
And what would be your hope for Digital Health Canada for the next, let's say, 10 years? 50 feels like hard to wrap my head around.
I just really hope it keeps attracting all of the people who work in digital health in Canada. Like, this is the place to be. This is where we associate together. This is where we connect and collaborate. You know, we use all sorts of big words, but really this is where we get together. And you talk to anyone in this room or anyone around the conference, this is how we do our world and how we really enjoy getting together and sharing, you know, friendship, learnings, knowledge, experiences, and that's the good stuff. And I just hope it continues that way for the next decade and more.
It's kind of hard to go through the reel in my brain of all the awesome moments that I enjoyed. Of course, working with the board members. But maybe something that I'm really proud about is the work we did together and with all the members to develop the 2023 to 2026 strategy. You know, coming out of the pandemic, it was a bit of an uncertain time and nobody really knew what the future was going to look like. How are things going to move? And so being able to connect with people who are working on the ground and really understand what their visions were, where they saw the opportunities were, and then thinking how we could respond as a member association to those needs and sort of set a visionary strategy that would support members, all the member types that we have, to be able to move forward and be successful in that. And so I'm really proud about how that strategy turned out.
And when I think back to that time, like, it was such an inflection point for digital health. I feel it must have been really meaningful to be working on it, like, at that moment in the health system.
Absolutely. There was so much uncertainty, right, from a political stance, from an economic stance, and actually just even respecting the health workforce who was burnt out and, all our industry players and stuff we were trying to support with the right tools. It was a moment of coming together, though, where all those challenges created the great will to say, okay, there's a moment in front of us and we can come together to deliver. And that was really exciting. And I think that the strategy tried to capture some of that and set it forward. And now the next strategy to come will even be able to deliver more on that. Oh, I have lots of memories though, because it goes right back from the beginning. Because I started off with Coach actually stuffing the envelopes to the members. I was 8 years old, so it was 50 years ago. I really tried to go into a different field, but I kept being pulled back, and here I am.
I'm curious, what did you try to get into?
Law. Yeah, I went into pre-law and everything.
Details, like helping people, like also like a public service, public
exactly,
good. I get that.
Yeah. But I think every conference was a new experience, right? And every conference grew. And I think one of the things, and we gave the Founding President's Award out to Dave Watling. Dave Watling, one of the core things that he was about was community. And that's what this conference is about, is community. And I think it bestows all of us to continue to show up, make time for each other. We all are mentors in some way, shape. We can all help each other. And the one memory I most have is that when my dad talked about why Coach, why did we have this conference?
The conference was conceived because you had things going on in Halifax, you had things going on in Edmonton and Vancouver, and people like Brian Shorter and Steve Husing, it's like, we want to know what's working, what's not working for you. So they thought, let's come together once a year. Might as well hold our AGM at the same time. And so it was to share the experiences, what worked, what didn't work. The vendors always were there. So I think it's just really continuing building this network. And we need this association more than we ever have, I think.
Well, it was really great hearing from those past presidents, Cassie and Don. So Don was not only a past president, but also the very first CEO of Digital Health Canada. And of course, Elaine was not a past president, but the daughter of the founding president, Steve Husing, and we still have a Steve Husing Scholarship Award. And so I loved the comments she made about the community, and she's so right. And that harkens back to the podcast that you and I did with Dennis Proddy, who was on the founding board of Digital Health Canada, and Chris Carvello, our current president. Again, throughout the reception and throughout the conference, that to me is what Digital Health Canada is about. And it's about community. And you saw that in spades. And not only seeing the people we haven't seen for so long, but a ton of new faces too. And like you said, excited to learn and to be there and to present. What a great mix.
I think that begs the question. I'm curious, having been to all 25 eHealth conferences, have you seen the community change over time?
That's a great question. And just reflecting on it, I think the big differences for me is the diversity of our membership. Health IT and IT in general was usually a male domain. And when you look at the founding board, there's not a whole lot of diversity there. Now there's so much diversity in our community and diversity of perspectives. And so that makes a big difference. And the other big piece was the number of patient partners. We had more patient partners than we've ever had, but we had, I think in most past years, we get maybe 15 to 20 patient partners applying to come to the conference. This year we had over 60. And so that just makes my heart warm, right? It's just like people are starting to know about us and patients are wanting to participate and be involved and recognizing the benefits and the difference that digital health makes. So that's a big difference as well, for sure.
I would also posit on that front, I think you've established it as an environment where patient voices are valued. On the first day of the conference, I was chatting with patient partner Anna Reardon, and she was saying that digital health has always been ahead of the curve. So I think, people are hearing about you, but I think also it's now an environment where people really want to come and they feel welcome coming and they feel like they'll be listened to when they get here.
Yeah, and we had a lot of patient partners, as you know, were co-MCs of the day, and they had I think you did some recordings at the Ask a Patient booth or the area on the floor, so the exhibit floor. So there's always, if you had questions, there was a place to go specifically.
Yeah, and it was really great to have that space. And I did go to Ask a Patient Partner with my microphone in hand, and I had a great time chatting with Alifa Khan and Catherine Rahal. So let's hear that conversation. As I'm here at the Ask a Patient Partner booth on the trade show floor, and I'm here with Alifa.
Hi, how are you doing, Katie?
Good. So we're on day 2 of the conference, which means we've all had a chance to hopefully have some great conversations. Any standout moments for you?
I think there have been a number of standout moments where, being here as a patient partner, number one, just having the recognition of the value of the patients in health data and noticing how our contribution to the conversation actually can change the trajectory or even the way in which we're able to proceed forward and actually change care, transform care going forward. And just noticing that how in as much as we've come as far as we've come, that there's still a lot more work to be done. However, if we're able to do it all together, the hope is that we'll be in a better position, hopefully, as we go along with time. I think at the grassroots, we're involved in the conversations from the beginning. really embracing what's important and meaningful for us. However, also looking at what needs to be gathered in terms of data and looking at our blind spots where we don't necessarily have the data to really inform care, to make timely decisions, and to really look at how we can elevate those areas where we know we don't necessarily have the data and need it, especially for populations that may be underrepresented or hard to reach or at a disadvantage. And what we can do to raise some of that in order to possibly take care of everyone holistically in the way that is most meaningful for them.
Everything is really so fragmented still, and it's much harder to function in that kind of a system. I think there's some very interesting software here that really could be helpful to general practitioners. So
It's interesting though, because I know we've heard throughout the conference, it's not just a tech issue; it's also like a people challenge.
it's a people issue and absolutely a policy challenge, because you really need to synchronize across the country, or at least make some kind of a bridge to be able to get information from one system to another more easily. Because when you go to a doctor's office and they don't have anything in front of them that's about you or any of your history, it's problematic. It's getting better now. When I see my GP now, he's got my whole history. And when I go to the pharmacy, they have my whole history. But I also shop at the same pharmacy. I don't go to a different pharmacy. So it depends on how you set yourself up as well. So everybody's got a bit of responsibility. There's patient responsibility, there's doctor responsibility, there's certainly governmental responsibility to make sure that all these things can synchronize and that all of the different provincial health agencies can do what they need to do. This is interesting for me. It's the first time I've been to a conference like this, and I've been in tech for a while. For me, this is really something I'm interested in.
I love those segments and those little snippets from the floor, and there was so much activity going on during the conference on the exhibit floor. There's little side meetings everywhere. Even going outside, seeing people walking together. It was just it's such a great hub of activity. And the things that go on as part of the conference content are one piece of it, but it's all the other conversations that happen and the relationships that are made, and the social events were always so great as well. eHealth 2025 is a wrap. What are your top takeaways from the event?
Obviously, we heard a lot about AI, and it was interesting to hear about AI and health data interoperability as sort of being two sides of maybe the same challenge, where it's we can't really take full advantage of AI until we have sorted out some of our challenges with health data, but maybe this interest in AI can help be another incentive to drive some of that work. So that was interesting. And we actually did, I think, have a really great conversation about AI and winning conditions for implementing it, which will be its own episode later on. The other thing that really stood out to me was I felt like digital health literacy was discussed more prominently. I heard it in a few different contexts, and again, in that sense of a driver or an incentive or a push to address some of the challenges in our health data landscape. So I think, again, it speaks to that involving public and the patients in a more meaningful way at more levels. It all comes down to, I think, this need to actually be able to share and to access data in a more fulsome way. But interesting to see kind of the AI kind of driving it from one side, and then this digital health literacy and involved and motivated and mobilized public driving it from the other.
Yeah, I think, well, definitely AI, but also a little bit of, so the key message around AI was one of those things, and one of the, I think was a closing plenary on the first day, was around let's not exclude people when we're doing AI. And so let's make sure that those marginalized and vulnerable populations, that AI is actually inclusive. And so real warning's probably too strong a word, but just a real reminder that as we're generating these algorithms, we need to be very, very clear around what data is going in. And then that would be the other thing. I think it's that data and infrastructure. And I sensed maybe a little bit more of impatience. And a couple of people sort of said to me, like, let's not talk about any of these things unless we have some progress to something actually new to say. And so I think even us as a community are getting a little bit like, okay, guys, like we need to move this forward. We need to push it a little bit more. And maybe this was generated by the interprovincial trade barriers being tumbled down. We have those in healthcare, and we need to address those in healthcare. And so I heard a little bit of that chatter on the floor, which I think is healthy.
I think it is almost a sense of frustration, or what I called hunger earlier in our conversation today. So I don't know, I hope that impatience can drive change. But also, okay, so I went to HIMSS Europe shortly after eHealth, and I was fascinated as they're talking about the European health data space, because they've laid some really clear and defined lines in the sand, right? So the regulation is now in force. By 2027, vendors need to be compliant with it. So there was no sort of talk of, oh, well, we hope by sometime in the future. It was very much, this is what will happen by 2027. So this is how we are preparing.
I love that. You put a stake in the ground, right? And you let everybody know it, and then you're more accountable. It's like anything, right? Like, the more people you tell you're gonna do, I'm gonna run a marathon, or I'm gonna lose 20 pounds, or whatever it is that you say, you tell as many people as you can, and then you hold yourself and they hold you more accountable to it. And then you can give, updates on how you're doing and monitor your progress.
And the whole conversation changes, because it's like, this is what's happening. So the conversation is, what are the steps we are taking to prepare for that? If this is our finish line, how are we getting there? Versus, let's hope by the next time and it's like, okay, like hope is not a strategy or an action. Actually, Derek Ritz from our international episode, I was able to meet in 3D, and shamelessly quoting him with that hope is not a strategy piece.
No, I love that, right? And you're absolutely right. And I think a lot of the co-hosts, like we were challenged, and to say, we need to put a stake in the ground. And that's a great, and see, let's go back next year and let's talk about the progress we have made. And again, if you haven't made progress, why?
And what's the date that we want to set, right? Because I think it's also at that point now, right? Again, we know what we need to do. So when do we want to see this realized? And I think it's okay to be a bit aggressive. The timing, as we've seen even now, right, with some of negotiations and conversations happening in other areas of society, nothing focuses the mind like a deadline. And the great thing about eHealth is that it brings you into conversation with the incredible people that are working so hard to realize exactly this future. So I had the great fortune of talking to a number of innovators around the conference. So let's cut over to those conversations.
Yeah, my name is Francesca D'Angelo, and I am a Clinical Innovation Coordinator at Hamilton Health Sciences.
Awesome.
And I'm Noor. I'm the Director of Clinical Research at Fluid AI.
Amazing. Thank you both so much for stopping to chat with me. So I'm wondering if you could tell me a little bit about how you explain what you do in digital health to friends and family.
Yeah, so I can get started. So for me, working in the innovation department, we are very lucky that we get to see all the cutting edge technologies and the latest advances in the healthcare environment. And I think that the way that we explain it is we are all the time trying to learn new things about how we can improve quality of care, how we can improve also our healthcare system from the point of view of burden to physicians and burden to clinicians and to nurses as well. So yeah, that's a little bit about how I see digital healthcare, and I think it's an ever-evolving field that I feel like it can never stop evolving because we always need healthcare, especially I think in our public sector in Canada.
I think for me, it's about identifying the main pain points that need to be solved, the struggles. Healthcare is a very, very demanding field with a lot of people who are overworked, overburdened. So for me, it's identifying the struggles and making sure that, from the industry side of things, that we listen and we build the right solutions for the right people to make sure that we can, push impact and improve care overall and improve the lives of the healthcare providers, those people who are on the forefront, and for the patients.
I'm here with Elise Maybe, co-chair and co-founder of the Patient Advisors Network.
Yeah, so it's been exciting to be at eHealth. I was at eHealth in Vancouver last year, and this year there's a different energy and a different sense that eHealth can really come together and make some big changes, initiate big changes. We're talking about the interprovincial barriers. There's an appetite for that going away. We were talking about the need to look at data, not just technology. And that excites me a great deal because data is the blood that runs through the veins of the healthcare system. So those are some of the things that I'm looking forward to learning more about as I go through the conference.
It's interesting what you say about the energy being different, because I feel like I also get very optimistic and very hopeful, but it feels like there's maybe a greater recognition of some of the stakes of not getting the data piece right.
Oh, I totally agree with you. And I think it's not just the data piece, but the vision that AI is here, it's now, and we need to deal with it, but there's so many possibilities, and we also need to understand the risks so that we get a good balance. And I see that people are really embracing this with enthusiasm in a way that I think was a little more laid back last year, and this year it seems a bit more full throttle.
And we're back with another one of our on-the-floor interviews at eHealth. And I'm here with Julia Zarb. Thank you for being on the show with us.
Thanks, Katie.
So, how do you explain what you do to your friends and family who may not be in digital health?
This is actually the hardest question because I have to say it depends on the person.
Yeah.
It depends on, I've been in this field for 3 decades. And it depends on, what decade I answer from, what hat I'm wearing. One of the funniest things in our family is that my daughters who are grown now, and my husband all have this sort of joke, which is, Mom, we don't know exactly what you do, but we're really proud of you. And so,
You're a secret agent is my takeaway from that.
Yes, I am. Well, that's another story. I would have loved to
Different
join
podcast.
the FBI or something. But we had, when one of my daughters was about 7, she had to do a school project that said, what does your dad do? What does your mom do? Your family. And so it's very straightforward. My husband's a dentist. So dentist, little picture of a dentist. And my daughter drew this picture, and she actually thought that what I did was fix the TVs in hospital rooms. Because I said, well, I help people in the health system with technology, and so to make sure that, information can be at the hands of people when they need it. So I find that what my friends and family think I do and how I explain it is that I try and remove barriers in the system and find opportunities for healthcare to work. When I start talking about how I'm trying to help people fix health systems, people will go to the personal space and say, oh, it really needs fixing because of this.
So as we start to wrap this conversation up, Sheila, where is your mind going to next?
Lots of excitement building for eHealth 2026. For the first time ever, the conference is going to be outside of Toronto and Vancouver, so we'll be in Halifax in Atlantic Canada. So tons of buzz around that. And I know the Digital Health Canada team is very, very excited about Halifax.
So if you had, I guess, a wish or a hope for people that attended this conference, that loved it, and are looking to attend in Halifax, how would you advise they spend the next year?
Well, so first of all, because it's our 50th anniversary, so participate in those things. And I would love to see more happy anniversary Digital Health Canada, but also consider putting an abstract forward. Like there's lots of opportunities and even taking advantage. I think for me, it gets to a point where eHealth is so busy that like I say, okay, let's meet at eHealth. Let's meet coffee break on day 1. So making a plan for yourself and a strategy, right? To say, here's what I want to get out of the conference. Here are the 5 people I want to meet. Here are the 7 vendors that I want to touch base with. And so having a plan for yourself and being involved as much as you can, by whether presenting or moderating or being on the abstract review committee, there's a lot of ways to be involved in digital health, not just sort of engaging when you're getting there. But that's a great, and you've got a year to prepare. So start packing your bag and pray to the, I don't know if I should say pray to the rain gods or the sun gods, because you want the weather to be nice, but you also want people to come to the session. So
Sessions on a boat. eHealth at sea. There you go. I can join your event team.
Yeah. Our networking reception can be lobster fishing or something.
Yes. Imagine the audio we could get from that. And before we go, I did also get a collection of 50th anniversary good wishes, messages, and words of advice from people at this year's eHealth. So as we close out, let's tune in and hear what they had to say.
My overall message would be congratulations on your 50th, and as you continue forward, I hope that you continue to dream big dreams, transform care going forward, and always remember your purpose and the intention of why you're doing what you're doing.
My wish is for us to be able to adapt faster, to grow faster, and to thrive and be able to keep up. Because, I mean, if you look at other industries, the advent of AI has been, very quick with other industries, but it's a little bit slower with healthcare. So, we gotta put our feet on the gas and push through and try to bring in the right tools to help the right people.
I think all health is digital these days. We don't say when we go online to do our banking, oh, I'm doing digital banking. We say, I'm doing my banking. And I think we need to start changing our mindset that this is the case. And I think now that we're at the 50th, that this is a good moment to think about it. And I know we're digital health, but digital is not an add-on. It is actually part of the warp and woof of what runs our health system.
I am so excited for Digital Health Canada. 50 years is pretty awesome, and I'm so proud to be part of this organization, and I can't wait to see what the next 50 will bring.
Happy anniversary, Digital Health Canada.
Thank you for listening to today's episode. Digital Health Canada members can continue the conversation online in the Community Hub. Visit digitalhealthcanada.com to learn more. Be sure to subscribe to the podcast to get new episodes as soon as they're available. And tell a friend if you like the show. We'll see you next month. Stay connected, get inspired, and be empowered.